we'll never forget.
What happened last night?
Am I missing a tooth?
Oh. Whose baby is that?
Check its collar or something.
Hi, I'm John Herring, and welcome to the Don't Do Drugs News. Today's topic is Rohypnol. What is Rohypnol? Rohypnol is a central nervous system depressant medication that is not approved in the United States. In this country, it is used for its sedative and muscle relaxant effects. Because of these effects, it is also associated with sexual assaults and is known as the date rape drug. Street names for this are roofies, R2, date rape drug, and roach.
Thank you, John, for that fascinating information. Also, there are many legal aspects about this drug. The use of Rohypnol to take advantage of others is considered drug-facilitated sexual assault. The drug is legal in Europe and Asia, where it is used for anesthesia. However, roofies is not legal in the U.S. Many times, the drug is smuggled into the U.S. and sold to young people, especially because the drug is cheap at an average rate of $5 per pill. Now that you know what Rohypnol, I'll turn it over to Taylor for an interview with Lexi, a doctor who can fill us in on short-term and long-term effects of Rohypnol.
And here we have Taylor, a local doctor from Woodwinds Hospital. Tell us, Taylor, what are the short-term effects of Rohypnol?
Okay, some of the short-term effects of Rohypnol, otherwise known as roofies, is a sleepy, dazed, drunk feeling that lasts 2 to 8 hours after the ingestion of the drug. Other possibilities include blackouts, nausea, fatigue, disorientation, and lack of motor skills. And one of the most popular or most well-known symptoms is loss of memory. The effects of Rohypnol begin within 15 to 20 minutes of ingesting the drug, and it reduces your inhibition, which increases your risk for physical exploitation, especially for women. It's a sort of conscious anesthesia, so you don't know what you're doing and you won't remember what you're doing when the drug wears off.
Thank you. And now please explain the long-term effects.
The long-term effects are in general the same as any other drug. So we have substance dependency and psychological dependence because it's normally used with other drugs such as heroin to heighten the high, or with meth to make the low even lower. And also there comes a point where the person is unable to sleep without taking the drug. And some of the risks with the ingestion of this drug include susceptibility to rape, which could lead to unwanted pregnancies and STIs, like some health classes in the state learn early in their trimester. And it also can over-relax your muscles, so you can lose control of muscles, which could be dangerous if you were to, say, be an athlete. And also, when you're drugged, you don't have very good inhibition, so you can't protect yourself from dangerous situations. And one of the other effects that you find commonly in patients is that after their experiences with roofies, they have a fear of going out and drinking ever again, and fear of being poisoned once more.
Thank you very much for your time.
Hey guys, it's John again, and after that intriguing interview, I bet you're wondering how Rohypnol became popular in the United States. It gained popularity in the 1980s when heroin addicts would smuggle the drug into the U.S. from Mexico to increase the effects of the heroin. It is the third most prescribed drug worldwide. It is also used to mimic the feeling of being drunk, and the highest dosage of it is the equivalent to 0.15 or 0.30 blood alcohol level. And in the United States, it is popular among housewives searching for relief from their daily anxiety and stress.
Thank you, John, for that fascinating information. There are also many ways that this drug, Rohypnol, is used. Roofies is swallowed as a pill, dissolved in a drink, or even snorted. It is also used to enhance a heroin high, which could be bad in the future, and also to mellow down a cocaine high. And lastly, Rohypnol is used with alcohol to cause amnesia and disinhibition. Now, here are some following ways to avoid ingesting roofies without knowing. First, do not accept drinks from strangers. Open containers by yourself. Keep your drink with you at all times. Also, if someone offers you to get a drink, go with them and watch them pour it for you. If you feel that you are getting drunk without any alcohol, get help immediately. Also, many people are addicted to this drug. Nowadays, there is ways to get help. You can see cognitive therapy, have a detoxification, attend group and individual therapy. Some people also treat roofies with another drug, like heroin or meth, which could be bad in the future for them. If you're at a party, you experience anything like this man right here, passed out across this table. He might have ingested Rohypnol. Then, call 911 and also call the...
Thank you for listening in for this week's edition of Don't Do Drugs. As a sort of comic relief and as our closing argument, here's a clip from a movie you all may be familiar with. Notice how easily and unknowingly Rohypnol may be ingested.
Now, we don't remember, because some
Doc.
drug dealer sold him Rooflin and told him it was ecstasy.
Rooflin, there you go with that word, Rooflin. Rooflin. What the hell is a Rooflin?
Wow, you are the world's
Crappiest.
drug dealer. Rooflin, for your information, is the date rape drug. You sold Alan roofies.
Oh, shit, I must have mixed up the bag.
You gotta let me. Alright, you messed me up.
No, we can cut the clip.
That's really close.
Yeah, that's right. My name's John. I got a huge zit on my forehead that you can see right now.
And now we're going to interview with one of the
It's gonna be awful.
Say 5 words.
Thank you, Taylor, for joining us.
And I never felt this way before. And I
Holy buckets.